Welcome to the Exam Room Live, brought to you by the Physicians Committee. Hi, I am the weight loss champion, Chuck Carroll, and this is the healthiest half hour anywhere online today. Appreciate you joining us right here on Facebook and on YouTube. Coming up, a new study shows that the true cost of diabetes doesn't stop at your health. It's also murder on your money. With insulin prices astronomically higher in the U.S. than the rest of the world, Dr. Neal Barnard will be here with ways you can cut down on those costs, improve your blood sugar, and maybe reverse diabetes altogether. Important messages today, Dr. Barnard.
Very important, Chuck.
And he'll be fielding your questions as well when we open up the doctor's mailbag. So if there's something on your mind, go ahead, drop that in the comment section now. Or as always, you can tweet them to us using the hashtag ExamRoomLive. And get this. Oh, my goodness gracious. She went from being a rocket scientist to a rock star doc. No kidding. She worked on the space shuttle program. And what a journey this has been for her. I'm over the moon that Dr. Niki Davis is here to share her out of this world journey with us. Dr. Davis, appreciate you being here.
Thanks, Chuck.
All right, but first, let's get caught up on the latest happenings. Here are your health headlines for Wednesday, October 7th, 2020. As always, we begin with a look at the coronavirus, where the number of new infections nationally has climbed 6% over the last 2 weeks, including roughly 40,000 new cases added on both Monday and Tuesday, bringing the total caseload to more than 7.5 million. Per capita right now, Middle America being hit the hardest, with infection rates highest in the Dakotas, as well as Wisconsin, Montana, and Utah, according to an analysis by the Washington Post. The U.S. death toll, meanwhile, is expected to surpass 211,000 today. In other news, if you've ever grocery shopped online, you may be familiar with this problem. You're looking for those nutrition facts. You're looking, and you just can't find them. Well, it turns out those facts and the list of ingredients are only available for about 85% of all packaged foods being sold online. This, according to a study that was conducted by the University of Minnesota. Here's the kicker. The packages themselves are required by law to have said information. The research also finds that while shoppers are usually able to sort by dietary preferences, such as gluten-free or even vegan, they don't have the ability, by and large, to sort items based on other nutritional attributes, such as the amount of sodium or cholesterol a product might have. Walmart, Amazon Fresh, Whole Foods, Kroger, and 8 other leading retailers were part of this study. And finally, another new study is serving as a stark reminder that diabetes is taking a toll on more than just your health. It can also drain your bank account. Insulin prices in the United States more than 8 times higher than other high-income nations. The analysis by the Rand Corporation finds the average cost of a unit of insulin in the U.S. is almost $99. That's 5.9 times higher than in Japan, 6.3 times higher than Canada, almost 9 times higher than in the UK, and nearly 28 times the amount that is paid in Turkey. Researchers say even if all drug manufacturer rebates and discounts are taken into consideration, prices would still average out to be about 4 times greater than most other countries. Wow. So let's talk about this. I want to bring Dr. Barnard onto the show here today to discuss, because here in the U.S., we have about I believe it's 1 out of every 10 adults actually has diabetes. And this study by the Rand Corporation with the prices, really just the latest reminder of how damaging this disease can be to both your physical and your financial health. And then you look at, well, who really has diabetes? And a lot of times it's people who live in less affluent communities. And so when you see the cost of insulin there and you have limited income, you're left to wonder, like, what do I do here? So What do we do?
You're right, Chuck. What we're seeing really is the residue of a commercial decision, which was that the pharmaceutical companies used to, do you remember this back years ago? You would have an infection. You take an antibiotic, you take it for a couple of weeks, you stop. So the drug company makes a little bit of money. But they made a decision, which was to invest in things that you would take longer term. An antidepressant, you're not going to be on it for days, you're going to be on it for months or maybe even years. An antihypertensive or a statin for your cholesterol. These are things that you take for life. So that's obviously a much bigger moneymaker. And the granddaddy of them all is diabetes, because you start off on one medication, typically metformin, you'll add another oral medication, and sooner or later you end up on insulin, and your doctor never tells you. that you're going to be on this for the next 30 days or 60 days. In fact, if you ask, they'll say you'll never get off it. You're going to be on it forever. And it's really a commercial issue. In fact, let me bring up my screen if you don't mind. I want to show you the rather stark facts of what one person's annual salary is. If you are the CEO of Eli Lilly, during a recent fiscal year, the one person's salary was $17.2 million. But if you're at Bristol Myers or Pfizer, Johnson & Johnson or Merck, you're making more than that. This is one person's salary. These are not nonprofit institutions. They are making money. Now, how does this happen? As you said, roughly 10% of people have diabetes. Obviously, it depends on your diet, depends on lifestyle factors and so forth. But almost one in three has either diabetes or pre-diabetes. That means you are a gold mine, guaranteeing that they're going to make tons of money on into the future. But that's really just the start. If you look at the costs of diabetes, it's medications, it's testing supplies. You do a little blood test to see what your blood glucose is. The meter, they will give you the meter for free in many cases because they charge you $1 for each strip that goes into it. So in the morning, you check your fasting sugar and then check after breakfast, before and after lunch, before and after dinner. That's 6 strips, $6, sometimes 7 times a day. So multiply that times 30 days, you're talking about a couple $100 in the strips. Your medical appointment, if you have to be hospitalized, plus the loss of income, and I'm sorry to say the loss of life. The average person with diabetes loses more than a decade of life. And economists will figure out what that's worth in dollars and cents. But here's what it really means on your medical chart. If you have diabetes, it's not the high blood sugar that will kill you in most cases. It's the fact that the disease process is destroying your heart. It's affecting your kidneys. It leads to neuropathy. That's the pain or the numbness in your feet or sometimes your hands or internal organs. It affects your eyes, and it also increases the risk of Alzheimer's disease. It about doubles it. And then the latest chapter of the story is that diabetes makes you really a setup for a bad course if you acquire COVID-19. Mortality much, much higher in people with diabetes compared to others. So that's all the terrible news. The good news is that we have a secret weapon for bringing down drug prices, making those CEO salaries much less, and tackling all of the expenses and the complications that I just described. And here it is, Chuck. See if this looks familiar to you. You ever seen one of those?
I think so. Yeah, it looks familiar.
That is an apple. Back in 2003, the U.S. government funded our research team here at PCR to find a better sort of a dietary intervention for type 2 diabetes. We started in 2003. We reported our first findings in 2006 and the long-term findings in 2010. And to just cut to the chase, the dietary interventions were what you'd expect. A conventional diet meant limiting calories and not too much carbohydrate and avoiding the bad fats. But the plant-based diet that we were testing in comparison to that was vegan, no animal products, kept oils low and low GI. So in other words, foods that don't release sugars into the blood very quickly. That was it. And the results made history because the red line is the conventional diet, their improvement of their blood sugar control, measured by hemoglobin A1C. Good. It was about 0.4 absolute percentage points drop. That's good. But the vegan diet was 3 times better. And Chuck, I have to say that in the course of this trial, we did something that doctors normally don't do. We asked everybody to keep their medications absolutely constant and to not change it. Even if they felt better, don't change their medications unless they became actually hypoglycemic. Symptomatically hypoglycemic, then we dropped it. And even with that very conservative approach to medication, 75% of the people had to reduce their insulin, and 100% of them were able to reduce their insulin. And so here's the point. You're hemorrhaging money at the pharmacy. And you might say, well, Medicare covers it, or my private insurance covers it, or something like that. Yes, and what that means is that you're just paying for it on April 15th, is what it really means. So if people are able to follow a healthy plant-based diet, their need for insulin goes way, way down. as well as all of those complications go way down. And in some cases, you'll get rid of the disease entirely.
I'm
So,
curious, from a physician standpoint, how frustrating can it be knowing that you may have patients who can't afford the medication that they need? And then conversely, knowing that if you prescribe a healthier diet and improved lifestyle that can help, really improve their blood sugar levels is there. I mean, does that make it easier to treat a patient and alleviate some of those frustrations?
well, I think that the real issue here is that up until recently, and we had done the work that we had done, doctors really didn't expect to reduce medications. They didn't want to reduce medications because they rightly realized that medications do control blood sugar. And in fact, the diets that had been prescribed were there almost to treat the medication rather than treat you. What I mean is, if you inject insulin, it's going to lower your blood sugar. So you had to eat in a certain way to keep your blood sugar in the right balance. And that was medical treatment. We decided to see if we could actually tackle the cause of the disease, help people to get rid of it, and hopefully be able to throw their insulin pen in the trash.
All right, Dr. Barnard, stick around. We will be opening up the doctor's mailbag in just a little bit. So if you have a follow-up question to this or something else on your mind, now is the time to go ahead and drop that in the comments section. You can also tweet that to us using the hashtag ExamRoomLive. Dr. Barnard, talk to you again in just a minute, my friend.
You bet.
All right. My next guest is, get this, a rocket scientist turned physician who specializes in nutrition and lifestyle medicine. Seriously, she went from working on the space shuttle program to practicing family medicine. How great is that? We're talking off the charts kind of smarts. So I am thrilled to welcome to the Exam Room Live for the very first time, Dr. Niki Davis. Dr. Davis, thank you so very much for joining us today.
I'm happy to, Chuck. Thank you so much for having me.
You may have the coolest career path in the history of career paths. So, I mean, really, how does one go from working on the space shuttle program to practicing medicine?
Yeah, that's a really good question. How does that happen? So, when I was in high school trying to figure out what I wanted to do with my life, I'll be honest, I was very interested in medicine and especially nutrition already at that time. But I thought it might take a little bit too long. So I knew I was good at math and science, and I enjoyed space. And so I decided to go into mechanical engineering, which was a 4-year program. And then actually I ended up getting my master's degree as well. So it took me a little bit longer. But I worked on the space shuttle program, and it was a very interesting job. But I kept finding that the things that I was reading in my off time, the things I was passionate about, the things I was talking about, always came back to nutrition. So I was fascinated with nutrition, and especially plant-based nutrition, and how it could help prevent and reverse chronic disease. So I had kind of a midlife, quarter life crisis and decided, I guess I'm going to go back and do some more schooling.
Hey, well, you know what? My hat's off to you. I mean, chase that dream. I think that's fantastic. It's your life to live. I'm curious, what is the typical diet for a rocket scientist?
So for a rocket scientist, I would say probably the SAD diet, the standard American diet, is probably the typical diet for a rocket scientist. Not this rocket scientist, but.
So you said that you had a keen fondness for plant-based nutrition. What was your introduction to the idea of a plant-based diet and the benefits that can bring in terms of a person's health?
So when I was 13, I decided that meat was not healthy. And I don't know exactly how that got into my head, but I just felt that it just wasn't healthy. I didn't know anybody who was vegetarian or vegan at that time, but I just felt that it was something that I wanted to try to give up. So when I was 13, I stopped eating meat. And I remember a couple of weeks later, my family had a barbecue, and I decided to have a bite of a burger just because it smelled good. And I decided, oh, maybe I'll have a little bit. Well, I felt really sick after that, and horrible. And so since then, I've been meat free. It's been kind of a transition into being vegan. So I've been vegan for probably almost 20 years now. But it's been most of my life that I've been vegetarian and then vegan.
So, okay, so this was already in place for you when you went to medical school. You made that big career change. Talk to me a little bit about what it was you learned about nutrition while you were in school versus what you already knew coming in.
So, unfortunately, you probably know this, but in medical school, we don't get a lot of nutrition education. Uh, it's unfortunate, and I'll be honest, the education that I have gotten with nutrition has been all on my own. So, for instance, there's the Cornell course for plant-based nutrition that I've taken. I've worked with Dr. McDougall, and I've worked over at the True North Health Center. So I've done a lot of nutrition training on my own. And in medical school, we did have a class where we talked about macronutrients. So you learn about carbohydrates and protein and fats. But really, when you really get down to it, we did not learn about the importance of nutrition when you're talking about disease.
Did you have those kinds of conversation either with your peers or your professor saying, "Hey guys, we are missing a big piece of the puzzle here"?
Absolutely. So, in fact, I was giving out books to my friends about nutrition. You guys have the Nutrition's Guide for Clinicians, and I was handing that out to people. So I was sharing it all over the place. And I'll say I'm very proud to say that all of my closest friends in medical school are now all plant-based.
Yeah. That's fantastic. By the way, that clinician's guide is also fantastic, and that is now available as an app. You can get that on your phone or your tablet. I don't know if you have that yet, but I mean, all of that information is right at your fingertips.
I do. I have it and I use it all the time.
When you interact with your patients, I'm assuming that you have conversations with them about their diets as well. How receptive do they tend to be to the idea of ditching that standard American diet in favor of the healthier plant-based one?
Yeah, good question. So I did my residency training in Montana, which, as you know, is beef country. So it was a little difficult. I did my best though, and it's funny because I used the physicians committee handouts for my patients. So you guys have on your website a lot of different handouts that you can give to people. So people with hypertension, with diabetes, with depression, anxiety, all of these handouts that you can give to people. So I did go out of my way to at least broach the subject with every patient that I had, to at least give them something, mention something. And I would say not everyone is receptive, but as long as I gave everyone the benefit of the doubt and gave everyone that information, the people you would least expect are the ones that would say, all right, I'm in it. So for instance, I had a diabetic patient. So she had diabetes and she had a gastric bypass surgery, and it reversed her diabetes because of all the weight that she lost. But then over the years, she slowly gained that weight back and she developed diabetes again. So she came to see me and she said, I am just not interested in insulin. I'm not interested in metformin. I don't want to take any medications. And I said, perfect. So let's try changing your lifestyle. So we had her go on a 100% plant-based diet, and we had her start moving more. And she was able to decrease her hemoglobin A1C, which is a marker of average blood sugar over 3 months, by 2.5 points in 3 months. So that's huge. I mean, most medications can't do that. So those are the kinds of things that I was able to do, even in Montana, where most people are eating a lot of non-plant-based items.
Oh man, that's fantastic, and it goes to score. I have bariatric surgery myself, and it goes to underscore that it is not like this magical pill. It's not the cure that everybody thinks that it is. It's like any other quote unquote diet. Over time, you can gain that weight back if you don't change what you're eating, you don't change your lifestyle. It's no different. And here this patient is that she's reversed diabetes, but or got diabetes for a second time. But sounds to me like she's doing great today, huh?
Yeah, it's one of those success stories. It's exciting, and it's what keeps me going, seeing that people can make this change and get well. That's my passion, is to help people get well. I love getting people off of medications. I love getting people excited about eating plant foods. This is my goal in life, is to help people.
So I am curious. You've already made one huge career change. What are your future plans? Like, you are one of the more fascinating people that has ever graced this program. I'm dead serious. So you've gone from being a rocket scientist and now being this wonderful physician. So is the next step to practice medicine in space? Like, where are we going here?
You're so sweet. It's funny you say that, because I think that one of the most sustainable things that we could possibly eat in space would be potatoes. So plant-based foods in space for sure. Uh, so my future plans. So I just graduated from residency this year. Yay. So all done with training. And my plan is to start doing what I will call wellness retreats. So retreats where people can either come in person or virtually. So in person was the plan, but now we're going to start doing virtually early next year. But having people be able to come in and change their diets, change their lifestyle, learn exactly how to do that. And then as a physician, I can help them get off of the medications, or at least minimize the medications. So I'm hoping to help people with chronic disease, diabetes, hypertension, arthritis, things like that. But then also being able to help people who want to lose weight.
I think that's fantastic, and goodness gracious, there are plenty of people out there that could certainly use your help. But please don't rule out that whole practicing medicine and space thing, or at the very least, let's look at making that space food a little healthier. I remember as a kid eating the space ice cream when I would go to tour the NASA facilities that were near me, and it tasted delicious. But I can't imagine that it was very good for me either.
Right. That stuff was the best. And, when I was working as a mechanical engineer, we had a little space shop at our facility. And so you could go in there and you could buy that stuff. I was vegan at the time, so I didn't buy it, but they did have it available.
Well, I like the idea of sweet potatoes in space. I also like the idea of this free event that you're giving tomorrow night. You're going to be talking presentation at Discover the Power of a Plant-Strong Diet to Help Prevent Breast Cancer. How appropriate here during the month of October. What are you going to be talking about?
Yeah, so it's interesting. So I've had a lot of things that I've been doing lately. One of them was I did a peaceful protest for the Physicians Committee for Responsible Medicine at the end of July. And this was to help close meat plants, to help protect workers. And I met a woman named Harriet who oversees the Salt Lake Thrive group, which is a plant pure community. And then she's also knows a woman in Pittsburgh. I think you had her on the show yesterday, Sally Lipsky. Yep. Who runs Plant-Based Pittsburgh. So in talking with the two of them, we decided October is Breast Cancer Awareness Month, so why don't we put something together for that? So we decided to put together a talk about breast cancer and the power of a plant-based diet. So we are going to talk about the 4 pillars: exercise, maintaining a healthy weight, limiting alcohol, and a plant-based diet. But we're going to really focus on the plant-based diet part of it.
That's outstanding. And that is tomorrow night. Starts at 8 o'clock Eastern, 6 o'clock your time, 5 o'clock out in the West. Definitely sign up. We'll try to put a link to register right in the comment section to make it easy on you. And visit drnikidavis.com to learn a little bit more about the rocket scientist turned rock star doc. I love it so much. Dr. Davis, you have a standing invitation to come back on this program anytime that you like. You are truly the most fascinating person that has been on this program in many, many months. So thank you so much.
Well, I really appreciate it. It's been a blast.
All right. Dr. Niki Davis, we will talk to you soon. And as she just mentioned, it is October. It is also part of our Let's Beat Breast Cancer campaign all throughout the month of October. Let's band together to beat breast cancer. And so I encourage you to head over to letsbeatbreastcancer.org and take the pledge to follow the 4 steps she was just talking about, the the steps that have been designed to help lower your risk of breast cancer. Pledge to follow those steps, get healthy with us. And just by doing that, you'll be entered to win a great prize pack as well with all kinds of goodies to get you going on your health journey. And by the way, a big thank you to Cleveland Vegan for supporting the Let's Beat Breast Cancer campaign this year as well. You see the web address on your screen, letsbeatbreastcancer.org. And oh, by the way, as if that's not enough, you also get a free e-cookbook that is filled with cancer fighting recipes as well. So head over to letsbeatbreastcancer.org. All right, time now to open up the doctor's mailbag. For that, we are going to welcome Dr. Neal Barnard back to the show. And Dr. Barnard, surprise, surprise, today's question follows up on our conversation about diabetes a little bit earlier in the program. And this one comes to us from Jane, who is watching on Facebook. She writes, I have a family member with diabetes whose doctor keeps telling her not to eat fruit. She still eats ice cream and treats, but I can't see why an apple or a banana should be treated the same way as those types of things. This family member, she's in her 80s and she's had diabetes for years. But can you please explain to me why fruit and ice cream are treated and processed differently by the body? I would like to be able to talk to her doctor about it.
Well, Jane, thanks for your question. And frankly, she's lucky to have you in her corner. And you are right to question the wisdom about fruit and what's the problem with fruit. What the doctor might be thinking of is fruit has sugar in it, and if you have diabetes, your blood sugar is too high, so we want to keep it low, so don't eat fruit. You'll hear people say this all the time. Here's why they are making a mistake. Laura, let's bring my screen up. I want to show you a diagram, if I may. You got that? Can you see that, Chuck?
Indeed, I can, sir.
Okay, all right. It's the glycemic index. It's a scale that was invented by Canadian researcher David Jenkins, who's a good friend and a brilliant scientist at the University of Toronto. He brought in volunteers. He fed them different kinds of foods and looked at their effect on blood sugar. And some of the foods turned out to be high glycemic index or high GI. That would be, say, sugar. If you bring in somebody and give them a bunch of sugar, what happens? Their blood sugar it rises really quickly. Same is true with white bread. Your blood sugar goes way, way up. But there are other foods that are low GI, low glycemic index. The same amount of carbohydrate, but a very different effect on your blood sugar. For some reason, the carbohydrate digests so slowly that it's really gentle on your blood sugar. So the high GI foods, that's red on this graph, the low GI foods, which is what we want, that's in tan. What's an apple? An apple and almost all other fruits, surprisingly enough, are low GI. So they're a great thing to eat, and they're a great snack, and it's perfectly fine. There are a couple of exceptions. Watermelon, pineapple are theoretically higher glycemic index compared to, say, an apple or a pear. However, because they are mostly water, you can still eat those too. So fruits are great. So what's the deal with ice cream? Ice cream has sugar, but it has so much fat in it that the fat causes that sugar to not be very rapidly absorbed. And so people say, well, eat ice cream. Is that a great idea? Well, I would say no, because I want to walk you through the cause of insulin resistance and the cause of type 2 diabetes. I've shown you this before, Chuck, but I want to bring it back because this, for some reason, tends to get lost. This is a cell. This big purple oval could be, say, a muscle cell in your body. And muscle cells, like liver cells and brain cells and all the cells of your body, they need sugar. That's their fuel. And that sugar is glucose. And it's outside the cell, in the blood. To help you, to fuel your cell, that glucose needs to get inside. But it's not inside, it's outside the cell, and it can't get in. It cannot get through the cell membrane. It's stuck outside. So what do? I need a key. Key is insulin. The insulin comes from your pancreas, and it arrives at the surface of the cell, and it actually attaches to a cellular receptor on the surface of the cell, just like a key in a lock. And when that happens, it stimulates these little channels on the surface of the cell to open up, and they open up and the glucose comes in. There it goes, hooray. Okay, so that's why insulin is so important. The insulin is the key to open up the cell. So what could go wrong? What goes wrong is what we eat. So my dinner came from a cow, and my lunch came from a fish, and my breakfast came from a pig. All these foods have a lot of fat in them, and oils too. So if I'm eating fryer grease and salad oils and meat and cheese, that fat builds up inside the cell. Let me show you what it looks like. There it is. There's all that fat inside the cell. Now, doctors hate words like fat because it has only 3 letters, so they'll call it intramyocellular lipid, but fat is building up inside the cell. This could be your ice cream fat. And as the fat builds up in the cell, the key can't work anymore. That insulin key it still attaches to the receptor, but nothing happens. That's called insulin resistance. And that means you're headed for type 2 diabetes. Or if you have type 2 diabetes, that's the problem. So now the sugar can't get into the cell anymore. You've got insulin, but it's just not working. The cell is insulin resistant. So what do? I decide I'm going to eat an apple. I'm going to eat a banana and a pear. And I'm going to eat other fruit and vegetables and beans and whole grains because they don't have any animal fat at all. And they don't have much of any kind of fat. So if I'm avoiding animal products completely and keeping the oils really low, you know what happens? The fat starts going away. And the fat goes out of my cell. And when it does, the signaling returns to normal. The glucose goes back into the cell. And everybody's happy. So that's the point. So what do I want to do? You should not be afraid of fruit. Fruit is great. It doesn't just have vitamins, but it has the carbohydrate you need in a healthy form that the body can absorb gradually and can use. So what we want to do is to go to a vegan diet, no animal products, keep the oils low, and you've got a shot at reversing this disease. So back to you, Chuck.
Fantastic explanation. And I really hope that Jane is able to just kind of isolate that clip from the show just then and take that and share it with her doctor. Because as Dr. Davis just said earlier in the program, there's not a whole lot of nutrition education that's happening in medical schools. So it's incumbent upon the doctors themselves to learn this. And if they haven't learned it yet, how could they know? And so you run into situations kind of like this, huh?
We have been writing about this for a very long period of time, but what I just described is not controversial. This is new to many patients. It's even new to doctors. But at Yale University, Jerry Schulman and Kit Peterson and their whole team, through magnetic resonance spectroscopy, have measured how the fat buildup in muscle and liver cells triggers this insulin resistance process. And you can also show how dietary interventions will make it disappear. So back a generation ago, we did not know any of this. We know it now. And we've got to get medicine into the modern age where if a person has diabetes, do not tell that person you will be on insulin for the rest of your life. There's nothing you can do. Once you've got diabetes, you'll always have diabetes. No. Explain the disease process. It has to do with fat buildup inside the cells. Let's change the diet so that we can manipulate that, pull it out of the body. And let's see if we can't improve your diabetes, reduce your medication use, maybe get off it. Don't throw your pills in the trash. Don't throw your syringes in the trash. Work with your caregiver to do this in a gradual way. And you may not get there, but many people do. So you want to take that power in hand. And by the way, let me make a shameless plug. My most recent book, Your Body in Balance, has a whole diabetes chapter that includes the scientific references. And so we give this to doctors for them to read so that they understand how they can really help their patients.
And the book, Your Body in Balance, it chronicles the story of a gentleman who had that very situation that you were talking about. The doctor told him, you will be on medication for the rest of your life. A gentleman by the name of Bob Blackburn. And he said, Doc, I don't want to be on medication for the rest of my life. And he went and he did some research, tried the plant-based diet, and voila, guess what? He's not on medication anymore.
Yeah, and many, many other people have been able to do the same thing. But it requires thinking beyond the sort of 1950s diet that people used to use. And now we've got far better tools. And what it really means is that a person with diabetes can live effectively a normal life. And by the way, I also have a section for people with type 1. If you have type 1 diabetes, you will continue to need insulin. But the amount that you need is very likely going to be reduced to a dramatic degree when you follow a low-fat plant-based diet because your insulin sensitivity is improved by the diet change. So a lot less insulin will usually suffice.
All right, Dr. Neal Barnard, go pick up your Body and Balance, available at your local bookstore or on Amazon.com right now. We will talk to you again soon, my friend. Thank you so very much.
Sure. Thank you, Chuck.
All right. If we did not get to your question today, I promise you we will save it and try to get you an answer on an upcoming episode. So go ahead, keep on tweeting them to us as well using the hashtag ExamRoomLive, or just fill up that mailbag, drop it right in the comments section. And don't forget, if you or someone that you love has diabetes and are ready to take control of your health, try to implement a lot of what it is that we were just talking about on the program today, want to implement that for yourself, the Barnard Medical Center is here to help. The doctors and dietitians, all of them, the very ones who have been on this show, they can work with you to help improve your diet. Go over again what Dr. Barnard was just explaining, and then take a look at your diet. You know, what's working, what's not working, and come together and craft a plan that can really help get you going on your healthier path. So you see the web address on the screen right now, barnardmedical.org, or you can call 202-527-7500 to schedule an appointment. Telemedicine visits are available now in more than a quarter of the country. So a lot of states and more coming online all the time. Visit barnardmedical.org or call 202-527-7500. Coming up on the show tomorrow, she is a true leader in the breast cancer community. Miss Karen Jackson will be here with us. Karen, she was diagnosed with cancer herself years ago. And although thousands of African American women are diagnosed every year as well, she found that support among that community, it was just lacking. So Miss Karen decided to take it upon herself and start her own network of support, a place where Black women could come together and talk about their joint experiences. She'll be here to tell us that powerful story on the Exam Room Live tomorrow. That is at noon Eastern, right back here on Facebook and on YouTube. So I encourage you to join us then. But until then, I want to say thank you again to Dr. Niki Davis for joining us. And of course, Dr. Barnard for bestowing all of that incredible information about diabetes with us here on the show today as well. And to the crew behind the scenes that makes the show happen, appreciate you. And you who is watching right now, my exam roomies, could not do the show without you either. We do the show, as a matter of fact, for you. So thank you very much for tuning in. And on behalf of everyone here at the Physicians Committee, I am the weight loss champion, Chuck Carroll. We'll talk to you again tomorrow. And until then, stay safe, take a stand, and keep it plant-based.